And according to the retrospective studies, the effectiveness of the closing incompetent and perforators ranges from 60 to 80%, depending on the technique used. Closure of the axial veins is more effective, is approximately 90%. And however, according to our observation, we very precise endovenous laser ablating using endovenous laser with a wavelength of 1940 nanometers and with a dual ring or, for example, infinite ring laser fiber results in perforator vein closure up to 90, even to 92%. And according to our observation, the closure of the trunk veins is even more effective, and it's approximately up to 96%. And according to the guidelines, incompetent perforators, we should consider ablation or classical closure of them. We use such equipment for ablation. Echo microwave ablation device, endovenous laser with dual wavelength, 1470 nanometers laser with a pullback device for vein ablation with steam, endovenous radiofrequency generator, 1940 nanometers later with corona infinite ring fiber. Now, just a little bit about the devices we use. A microwave generator is ideal for closing large vein trunks due to its diameter. We don't use it to ablation incompetent perforator or tortuous vein. Double wavelength laser is good for closing large and small venous trunks. We use it for everyday ablation. In our opinion, less effective than 1940 nanometers laser. Barnes and revascularization of ablated venous trunks and perforators occur more often than in the case of, for example, 1940 nanometer laser. This is because this is possibly also due to the single ring tip laser fiber. Single wavelength laser with 1470 nanometer is good for closing large and small veins trunks. Very useful for closing revascularized long vein trunks because of very precise ablation performed by a pullback device. Significantly shortens the surgical procedure time. In our opinion, as effective as the 1940 nanometer laser, but not for perforators because there is no system for introduction to white fiber into the incompetent perforators. And device for vein ablation with steam. VenoSteam device closes varicose vein with a dry steam. Good for closing large and small venous trunks or incompetent perforators. We use, it's very useful for closing revascularized long vein trunks with tributary varicose vein. In our opinion, as effective as 1940 nanometers laser. And there is a significant risk of skin burns at the site of venous access, or in the case of subcutaneous course of obliterated veins in the hands of inexperienced operators. Next one. Endovenous radiofrequency laser is good for closing large and small venous trunks and perforators, useful for closing revascularized long vein trunks, and in our opinion, a little less effective than 4070 nanometers laser due to slightly higher recanalization rate. Useful for closing telangiectasia and spider veins. And the last one, single wavelength laser with 1940 nanometers is good for closing large and small veins. And venous trunks and perforators. We use it for everyday ablation. In our opinion, the most effective laser we have used so far. Balance and revascularization of ablated venous trunk and perforators rarely occurs. In our opinion, less often than in the use of other ablation techniques.